welcome back, or welcome if this is your first time visiting. My name's Tina Hurley. I'm the founder and executive director of a nonprofit, Less Leg, More Heart, that provides support, supplies, and services to improve the quality of life for people living with limb loss. And you wouldn't think there's many of us, but there's actually more than 2.4 million currently living in the U.S. And by 2050, they expect there will be more than 3.6 million people. That's about 500 or more people a day just here in the U.S. that loses a limb. For reference, that's up to almost 200,000 people a year. And you don't really see that many of us walking around. And there's a lot of reasons that we have barriers to accessing the world and flourishing and thriving in the same way that folks that don't have similar mobility challenges do. So this platform is here to bring inspiration and perspective and education to you in the comfort of your home, to pull back the veil of limb loss, and also to provide options for different types of therapies and modalities of treatment that maybe you haven't heard about, maybe you're not sure a lot about, or perhaps don't know where to go to get those types of treatments. And so in that same vein, I'm really excited about today's interview because I have a local amazing resource that has some pretty targeted treatments that for my demographic is very specific, but also it's universal for so many people. Without further ado, I'd like to introduce you all to Ginny Hartnett. Thank you so much for being here today.
Tina, thank you for having me. I'm really glad to be here.
Yeah, me too. You know, we met in a women's networking event,
Yes.
and it was, more than a year ago.
Yes, it was.
And time just travels, and we'd had some conversations, and she does structural integration work, which I was familiar with just because of my own Humpty Dumpty situation and all the folks that have put their hands on me. But I'm excited for you to share more about that. But specifically, she was learning more about and getting more focused on scar work. And Lord knows I have a lot of scars, and she hadn't had a lot of experience working with specifically residual limbs, but scars are scars. So I'd love to have you share your path about where you were in your life or career and how you sort of started getting into this really fascinating work that you're so passionate about, and where you took the detour into scars and why they're so exciting for you.
Sure. Well, I started my work in the fitness industry, and that led me to attending a workshop about fascia, which I found fascinating. And fascia being the white, what we used to call sinews that surround the muscles and the organs and whatnot. And in the last, I'd say 15, 20 years, it's had a big resurgence in the fitness industry in terms of self-myofascial release. You might know that as foam rollers or those little massage balls that you can buy and work on yourself, or you've even been to a practitioner that works with fascia. So working with humans and movement led me towards the doing of the body work, which I found most interesting, not so much in the realm of spa work, which is wonderful, by the way.
Oh, yeah.
But I was more interested in solving the puzzles related to the fascia and the muscles and why things would or wouldn't move. So I went to school up in Maine at a place called Anatomy Trains, and that's where I learned to do structural integration. And that is more about working with the body as a system and less about chasing a symptom. And from that school, that led me to learn about a woman named Sharon Wheeler, who developed a type of work called scar work. And she also is a structural integrator who studied directly with a woman named Ida Rolf, who was the originator of structural integration and a system that became known as Rolfing. But Sharon took that work and then found, in working with a friend that had had a car injury and therefore some big scars on her leg, just very casually working with her friend, they discovered that the working with the tissue improved her scar and improved her movement. And it was a surprise to both of them because neither one of them knew that her just working with the skin was going to give that kind of a result. So that led her to spend more of her time and working with scars and seeing how she could get them to change. And so her methods were showing signs of making the tissue change, integrating the scar tissue, but in a very gentle way. I know there's many different ways that scar tissue can be dealt with. Some of it is more harder work, more maybe rougher on the skin. She found her approach could be very light and very gentle and still give results. So she sort of worked on that on her own, and then it wasn't until, so her original discovery of it was around 1973. So that was something she really started to share with the world in the early 2000s. And she assumed that people already knew about this and just were, it was just something she hadn't come across. But when she shared it with people, she found that they did not know what she had discovered. And so she started teaching other people just to improve, make the world a better place, help people work with scars. Because she was taught to work around them. And she found that if she worked scars first, she got better results when she did her structural integration work.
Incredible. You know, the thought that people are so prone to that trial and error, and then there's others that just, it doesn't work, so it doesn't work. And then there's these curious innovators that will, well, why doesn't it work? And let me see if it can work. And just it's so awesome to see people solving problems and being so progressive. And it's sad to me still that, God, that was 50 years ago. And that even still in my journey, I'm an amputee for 10 years and I was an amputating clinician. I didn't know much. I wasn't taught about those things in school. And we're only talking 15 years ago. So that we still have so far to go to bring some of these modalities and therapies to the forefront so that people understand the plethora of options that exist besides taking more medicine or doing more surgeries or getting more invasive procedures, which sometimes have a place.
Oh, sure.
But let's give them all of the options,
Yes.
and especially the ones that may cause less harm and may work. So I'm really excited because when I had my leg amputated, I had 3 surgical revisions higher and higher, and I had very densely adherent scars. They did injections and prednisone, treatments recurrently, and they would itch all the time, and they would hurt, and they were visually distressing. But for the inside of a limb, it is a functional space. We pop our leg off, and we've got our socket, and then inside here is our leg, and that scar, if it's adherent or it's not, mobile and soft, it will pull on tissue as the limb moves inside the socket, and it can cause blistering and frictioning and wounds and pain and immobility when people are off their leg. So the implications of having undertreated scars are significant in a weight-bearing socket like this. And so the avenue of treatment for this is so exciting.
Yes.
Because people only have something positive to gain. And I think about people that have traumatic limbs, or may have maybe they're geriatric and they have very friable skin or thin skin.
Yes.
Some of the other modalities that I was very briefly shown in my PT recovery was a deep, aggressive, put coconut oil on your thumb and just grit your teeth and get in there. Not a lot of people in this demographic or the aging demographic, which is largely the vascular cases of amputation, would likely tolerate that well and thus not be compliant with it. So the idea that this is a very gentle and more humane in ways approach is a really exciting concept to talk about. What do you think, I know that you hadn't worked with amputees, but what do you think are the similarities between limb-related scars and non-limb related scars, and then what could be some of the differences?
Right. Good question.
Yeah.
Well, every scar is a story, and everybody's story is different, so therefore every scar is different. So I think any scar that you look at, whether it's on an arm or from a surgery or from an accident, you feel that scar tissue in your hands, and you work from there, and you think about how can I take the tissue that's there, which is all good stuff. I think we tend to think of scars as it's rougher, it's bad, or I don't like it. It's still all good stuff that just needs to be reknit into the fascial fabric. That doesn't mean it will make it go away completely, but with scar work you can ease it. You can change how it feels, how it moves, how the whole skin moves. And so whether that is on an arm or a leg or a residual limb, you address each one as an individual story, as an individual scar.
I love that. It's so exciting. Well, when you think about the history of this scar work and you think about your life as a structural integrator and then the scar work addition, what is the most exciting for you, and why do you focus on scar? What is the passion about it that makes you get excited to do work on scars? Because it doesn't seem like there's a lot of people focusing on them. So what's the why?
It's a piece of the puzzle. It's always the puzzle of how can we get better movement or more integrated movement. And I think a scar is just a piece in the bigger puzzle, but it's probably the piece that you want to look at first, because it may be the piece that's holding something down more. If you wanted to try and open across the chest and there was a scar there, you may do very well with the muscle or the fascia around it, but if you haven't addressed that little part that's tacked down, or almost like a snag in a sweater, if you can free that, then everything else can fall into place easier.
Nice.
So I would say it's one of the first pieces of the puzzle that you want to figure out.
Right, and to your point, prior to you learning all these things, it's sort of the thing you go around. And so because the medical systems or systems in general are further behind the current research, and it might be something that other people in other realms that they're being treated are working around still. And so you may be able to pull that missing link back into the forefront.
Yes. I think you do find a lot of really good practitioners doing really good scar work in the breast cancer community, in the recovery from breast cancer, because there's been a lot of attention to that, and there could always use to be more. So I think, and there are some realms where it is known and it does exist. I think we just need to spread it out to other areas.
Where can people go if they're interested in finding more about the type of work that you do?
Sure. So I would say if you are interested in scar work in general, you could visit Sharon Wheeler's website, which is sharonwheeler.com, and it's spelled just how you'd expect. If you were looking for a practitioner, anywhere around the U.S. and Europe, and actually I think it may be global, scarwork.uk is part of Sharon's grouping, and they have a Find a Practitioner link. That you could go on, and that would be, I believe it's global from there.
Right.
So.
And if people said, I want to learn more about Ginny's style, where do they go?
Oh, my website is, it's Ginny, S-I, for structural integration, .abmp.com.
And what is the ABMP?
That stands for the Association for Bodywork and Massage Professionals.
Beautiful. Well, I love that. I'm so excited that people know you as a resource, know this type of topic, know where to find more information, and I think it would be really cool if we could show them a little bit. What do you think?
I would love that.
Let's do it.
Okay.
So we're all set up, and I'm really excited to get some scar work done and show the people all about the methods that you use. Let's go ahead and I'll lead you to the place where I have the most scars.
Okay.
And this is a residual limb. A lot of people can call it a stump or there are all these fancy names for it, but if you wanted to be politically correct and you're working with amputees, residual limb is a nice way to just be politically correct. So here she is in all of her glory. And as you guys can tell, you may not be able to see it as well on the camera, but I had several bypasses, which is a vascular plumbing kind of thing, that they had to cut all through the inside of my leg, all the way up to my hip, and also on the end of my leg where they did the sort of fish mouth, kind of close things together when they amputated. And so there's a lot to choose from, and some have had different injections before, and some have just been mauled around. I was talking to you about the interesting thing with residual limbs is that these legs or arms live in this liner, which is a non-breathable, non-permeable bucket, and it really, the skin itself and the integrity of the skin itself and the pressure and the friction and the moisture are all significant considerations even for healthy skin. But when you add scars in there, scars because, and you can speak more to this, how they move and behave differently, it creates situations where if you have moisture imbalance or friction, you get really painful blisters and wounds, and that can lead you to not even be able to put your liner on and walk, for periods of time, or God forbid get infected because these harbor bacteria as well. So working in this area is super important to help with the functionality of prosthetic users. But take your pick. You got all of them to choose from.
Okay, well, thank you. Well, first of all, are you comfortable?
Yes.
Is having a bolster here comfortable for you?
I do feel comfortable, thank you.
That can be changed at any point in time if your comfort level changes. And I have your permission to put my hands on your leg, do I? Thank you very much. So I think what we'll look at is some of the scars that you pointed out here. And I just want to say, before somebody has scar work done, they really want to get permission from their doctor. If it's a fairly new scar, if it's, years old, you can still do work on older scars and changes can happen, which is kind of surprising. But new scars, you want to make sure that they're healed, that there's no open, that any infection could get in. But really getting a doctor's approval is the best thing. A rule of thumb is 6 weeks after a surgery, more if it's a more significant surgery. So just keep that in mind, because we want the work to only be beneficial.
Yes, that's a great thing to mention.
So I'm just going to start by gently placing my hands on here and investigating the tissue and getting to know the scars that I'll be working on.
And in that process of investigation, what types of things are you seeing, sensing, feeling?
I'm feeling for the texture of the scar. I'm feeling for the thickness of the scar. If I feel that there's any little hills and valleys around the scar, that's good for me to know. This work is all very light. It should at no point hurt. So I need you to tell me right away if anything is uncomfortable for you.
Yeah, because it can't kick you.
That was pretty strong, though. Can I have a little? Can this fabric come up a little bit? That's fine. And you can work through fabric, but it's much easier if I can have my hands on your skin. And I'm going to start with something called just being a very light touch, a sweeping, where I'm going to brace with one hand and just sweep down.
And what is that doing?
So this is just preparing the tissue in a very light way. Very light way. And we work towards the scar. We're always going to work towards the scar. So from below, from across, I'm just going to, thinking about anything that was happening below the tissue when that incision was made. Any inflammation of the past that was there. Sometimes there's still little bits of density or thickness that we just want to smooth things out a little bit. Get you used to my touch. I get a chance to find out if anything's bothering you. And change what I'm doing. But this is actually really a great place to start for scars, just to sweep towards the incision point.
You know, and from the user perspective, as you're doing this, it's warming, it's gentle, it really feels relaxing, but also for people that may have dermatomal distribution issue, so what that means is if people have been cut, all of those tiny little nerves, there's bigger nerves and there's smaller nerves, and some are for motor and some are for sensory. So sometimes with people that have had reconstructed limbs, you could touch here and you could feel it somewhere else. And so it's interesting when work like this is being done, where we feel that referred sensation and how that could change possibly over time with different loosening of that adhesion or that scar area.
And that's very interesting to me, because I will tell you, I've worked on a lot of scars, but I've not worked with a lot of folks with residual limbs. So,
and I think the benefit too of improving some of that sensory input, you start to feel more exactly where the pressure is being applied, is that I sense where my foot is at in space based on the circumferential pressure around my leg that's in my socket. So if a pebble is under my toe, I feel a pressure on the front of my shin. And if a pebble is on the back of my heel, or say I'm walking and there's a wedge under my heel, I feel it on the back of my calf. But if I can't feel the front of my shin or the back of my calf, then my ability to proprioceptive my foot is impaired.
Sure.
So by enhancing the ability to feel those sensory inputs, you actually can improve the way in which you perceive the ground and potentially walk better.
That's amazing.
Yeah, there's some pretty good extrapolated outcomes from this. Are keloids amenable to this type of therapy?
You can't make the keloid go away. That's kind of a tough one because there's a lot that's been laid down. But you can ease the edges of it, and so I mean you can do something about it, but it certainly isn't going to go away.
It's a little bit more of an aggressive form. Are there things like, obviously improved movement, improved aesthetics, and then is there improved circulation of nutrients and blood?
I think anytime you're working the tissue, you're going to see an improvement in the lymph and the blood flow like that.
That's awesome.
Yeah. All right, so I've done some sweeping all along, so now I'm going to work a little closer to the edges of it. So I'm just going to scoot myself around a little bit. You're good right where you are. All right. So I'm just thinking of, and the way it's been explained to me is when you think about the edges of the scar, it's almost like you want to take two hairbrushes and bring the bristles together and get things to to mold together. So I'm just going to bring those two sides together.
And there was a fun name for this. Was this the one with the cat?
Oh, yes. There's, when you're doing a little bit of work, it's almost like, you know, when you get a cat on you and the cat is kneading. Yes, so we kind of call this the kitty, the cat or the kitty. And if it's little, they call it the itty bitty kitty.
That's
If it's a
so
little
funny.
tiny scar, you can get in there with just your fingers. So this is just the idea of
Yeah.
easing it and bringing it together.
And that's
And again,
interesting
should
because
be
it's
no pain.
and it's counterintuitive, because you would think, at least when I was taught, and I say taught very loosely, someone like handed me a pamphlet,
Yeah.
here's some information about scars way back in the day. I feel like it was more about stretching or pulling it apart and really digging in. And the approach that you have is so different, and I would imagine better. I mean, you have a whole technique, like you're doing sweeping and then you're doing this motion. Like there seems to be a series of things that you're walking through. Is it true that you sort of have a specific approach to each scar?
Yeah, and the scar will sort of talk to you as it reacts to what you're doing. So you can't know what's going to happen exactly, but you try different techniques and you see what happens. And that's really the way when Sharon Wheeler created this, it was out of investigation. It was out of curiosity and saying, well, what happens if I do this? What happens if I do that?
So this is a really fluid type of management, in the sense that
Yes.
it's the scar is guiding you, and
Yes.
you're not really rigid and fixed in the process.
You're not going in with a specific protocol. You have different maybe techniques you might try based on what you find after working on it for 5 minutes, 10 minutes. For some people, you might be doing that first sweeping motion for a long time before you want to work on the actual scar itself. So
What does
so-
success mean?
that there is more ease in the tissue for the person, that the person feels that the scar is more an accepting part of them. They're accepting it back into their tissue a bit.
You know, that's an
or
interesting-
for some people, it's that it's less visible.
Yep.
It depends on what the individual and how they feel about that scar.
On our first session together, I know we had talked about, in general, people with disabilities are often isolated. And also, before you come to a place of acceptance with something so different appearing like this, you know, even just people being in the shower with themselves is very triggering. But for them to be in an exposed state with someone touching the things that have so much physical and emotional trauma, for so many people, I bet they've never even had that type of care. And it must open up the avenue for emotions for many people. Like,
sometimes.
right? Are there any stories, or how can you relate to that emotional piece of the work that you're doing? Because it just feels connected to be rubbed on, and for someone to be giving therapy to the areas that have such profound memories that are not
Yes.
good.
Yes.
And that's that beyond the scar work you're doing is a feeling of comfort, and I know that can be healing in and of itself.
Yes. Yeah, I think sometimes when there is a scar put upon us, either through a surgeon's knife or through an accident or something like that, we tend to put it in the past and not think about it, which is fine. Working on it can sometimes remind you of what happened when you were a child and you got this scar that you've been carrying for your life. And sometimes to remember that can and think about it can be healing. Sometimes it can give you an emotion, and we just kind of roll with it.
Yeah.
Like if that comes up, you kind of let it happen.
Yeah. Yeah, triggers in a way is what comes to mind, right? Is like there's certain triggers, and just being able to be in a safe space where it's okay to just be however you are, and that yogi sense of like,
Yes.
it's here, I can acknowledge that I feel a certain way, but there's no need to fix it, solve it, react to it. Yeah.
Right.
It's pretty nice to hold that space. And so what's interesting too is as the scar work is happening, and every limb is going to be different, I have a heightened sensation of what I infer as nerve sensations, like a tingling, which often in the history of my healing has been when things are loosening up. I start to get more buzzing, not painful,
Interesting.
but it's happened on a number of occasions when I've had increased blood flow, or when I've had adhesions that have moved or been, quite frankly, ripped from my using my leg. So I can tell that there is something happening underneath there.
Very cool. Very cool. All right, I'm going to go right across it. So just let me know if there's anything in here that's bothering you at all.
No, but it's really fascinating, the sensations that you'll get in the limb. Like the end of it right now, for anyone that doesn't have a leg amputated, maybe a lot of folks watching, if you, a TENS unit, like an electrical stim unit, where you put it on your skin and then you turn it up and it feels like little electric flowing, doesn't hurt, but it's like this sensation of buzzing under the skin is what many people that have limb loss experience. Some can be very intense nerve pain, especially in the first couple of years after amputation. And then over time, whether we get more conditioned to it and it becomes more white noise because we've trained our brain to ignore it more, or if truly those nerve fibers and inflammation pieces calm down, or a combination of both, we tend to, the lucky ones tend to sense it less. But ironically, and this is just anecdotal, meaning my experience, hormonal shifts, manual work, and also barometric pressure can all make those come back in a more intense way, and then have a period thereafter when it does crop up that it gets better for a few days, even better than the normal baseline. So it's kind of interesting, but you know, you wouldn't know this unless you're out here living this one leg life.
Right, right.
Yeah, it feels good. What are things that people may have as misconceptions? Do you deal with any kinds of misconceptions about scar work in your line of work?
I think just that they're there and nothing can be done about it, I think is the biggest one as well. I never thought about that. I thought it was just what it was. But you can always do something about something.
Do you find that there could be an enhancement in, you know, I just think about how many touch points that person before they get to you has been through in the medical system.
Yeah.
For me, it brings up the need for maybe more learnings in academia, or more CEU courses in operative type practices, or ancillary service providers. Like, do you think that is there more we can be doing to set patients up to be able to know things like this that otherwise they're coming to you going, I had no idea about it?
Right, right. I mean, I think just look at what else is out there. Try different modes of manual therapy and see what works for you. What works for you might not work for somebody else as well, or they might experience it differently. I just would say, if it's something you want to address, keep looking around, keep seeing what's out there.
Yeah, and I think that's a good point in general. If you're not getting where you want to be, it's important to just keep looking, keep finding, keep getting consults, keep trying to turn rocks over, because eventually you'll open a door that's a whole nother building of opportunity or services you didn't even know existed. Right. So that's a really good point. And
ask others what they've done and see what's been successful for them.
Yes, that's a big one. And also too, we only know what we know because of the experiences we've had. So collective knowledge is so important, but also there are pitfalls within the current system in terms of funding and affordability. And people just need to be mindful sometimes of the channels that they're in, because we're so busy being a patient that sometimes we're not looking outside the snow globe going, why is that path in this place? And why isn't this path over here available to me? So if there are particularly people in the limb loss community that would benefit from services like this, or alternative modalities of therapy, aside from what their insurance is affording them, situations like Less Leg More Heart organizations are here to help fund those to reduce the financial barriers to them. And there's a lot of other nonprofit supports. You were mentioning breast cancer earlier. I imagine someone out there has created some types of additional funding sources for folks for this type of work as well. So if you want help getting plugged into the nonprofit sector, you could always Google those things or ask for local resources, or even ChatGPT these days are a wonderful resource to find those options. But it's been really exciting to share this information and for people to see this modality of therapy. Are there any final words or pearls of wisdom that you would like to leave the viewers with?
I guess just keep investigating your scars yourself, and find new ways to move, find new ways to incorporate those things into your everyday life.
That's right. Be a relentless student of your own health.
Yes.
I love that. Well, Jenny, thank you so
much.
I'm so excited, and I can't wait to see you again.
Same here.